Good morning. My name is Ethan Buckland, and today I'll be looking into the genetic disease sickle cell anemia. So, what is sickle cell anemia? Well, sickle cell anemia was first discovered in 1910 in the United States. The origin of the name comes from the appearance of red blood cells in an affected person. The cells end up looking like sickles, and sickles were used to cut wheat, and still are by some more old-fashioned farmers. Sickle cell anemia is caused by a change in the gene that tells the body to make the iron-rich compound in red blood cells called hemoglobin. Hemoglobin enables red blood cells to carry oxygen from the lungs throughout the rest of the body. The hemoglobin associated with sickle cell anemia causes red blood cells to become rigid and sticky. This can cause various complications, which I will touch on later. For a child to be affected, both the mother and father must carry one copy of the sickle cell gene, also known as a sickle cell trait, and then both of these gene copies must be passed down for a child to be affected. If only one parent passes the sickle cell gene to the child, that child will have the sickle cell trait, with one typical hemoglobin gene and one altered form of the gene. People with the sickle cell trait make both typical hemoglobin and sickle cell hemoglobin. In this case, generally, these people are only carriers of the gene and do not have any symptoms. Signs and symptoms of sickle cell anemia usually appear around 6 months of age. They vary from person to person and may change over time. Signs and symptoms can include anemia, which is a shortage in red blood cells as sickle cells die out fast in between 10 and 20 days. Episodes of pain. Pain develops when sickle-shaped red blood cells block blood flow through tiny blood vessels to your chest, abdomen, and joints. Swelling of the hands and feet. The swelling is caused by sickle-shaped red blood cells blocking blood circulation in the hands and feet. Infrequent infections. Sickle cells can damage the spleen, increasing vulnerability to infections. Delayed growth or puberty. Red blood cells provide the body with oxygen and nutrients needed for growth, so with a lack of red blood cells, puberty will be delayed. And lastly, vision problems. Tiny blood vessels that supply the eyes can become plugged with sickle cells. This can lead to retina damage. Additionally, sickle cell anemia can also lead to a large amount of complications, including strokes, acute chest syndrome, pulmonary hypertension, organ damage, blindness, leg ulcers, gallstones, priapism, deep vein thrombosis, and pregnancy complications. If you carry the sickle cell trait, seeing a genetic counselor before trying to conceive can help you understand your risk of having a child with sickle cell anemia. A genetic counselor can also explain possible treatments, preventative measures, and reproductive options. And that's the end of my presentation. Thank you for listening.